Remember, if you guys have any questions, please ask them in the chat, and then we will have a little section at the end where we can go through and answer any of your guys' questions. We're going to start off with a typical what goes on in the day, and then a little bit of background to how he got where he got, and then we're going to end it off with a case study. So Dr. Shah, if you'd like to introduce yourself.
Sweet. Yeah. Thank you once again for having me. So my name is Deep Shah. I am a board certified pediatric dentist in Philadelphia, Pennsylvania. Kind of a little bit, I guess, about me is I'm a father of two. I have an awesome, lovely wife. We've got a golden doodle who's 4. So a lot of time at home with the family. Love hiking, love sports. And like I said, that really just defines who I am as a person. Now, what I do is I'm a dentist. So that's kind of like my profession, and that's like my real passion. In terms of what I do currently, so I'm in academia. So I'm attending at University of Pennsylvania School of Dental Medicine, and also an attending over at CHOP, which is the Children's Hospital of Philadelphia. And so that's kind of the academia sector that I'm a part of. And then I'm also in private practice out in like the Westchester Exton area, which is a suburbs of Philadelphia. And I'm there 3 days a week, and kind of seeing my own patients and things like that. So that's kind of like a little bit of a balance in terms of the work that I'm doing. Yeah, it's a lot of fun. Like I said, both academia and private practice are very different. They're both very rewarding, but they come with their own challenges. And they're just in a way, they are just a tale of two cities.
Mm-hmm. So delving more into what you do in a typical day, do you want to talk about maybe how many patients you'd see on a typical day and what type of procedures you'd perform?
Sure. So on a typical day, dentistry is kind of broken up into operative procedures, which are patients you're physically seeing and you're doing, dental procedures on. And then you have a hygiene column. So you have hygienists. These kids are coming in for their cleanings. The hygienist is doing the cleaning, but as a doctor, you're going in and doing the hygiene, the kind of the check or the cleaning check. So on a typical day, I'm seeing maybe about anywhere from 10 to 15 patients of my own that I'm actually doing work on, that are on my operative column. 15 is a max and usually a stretch. And then on the operative side, on the hygiene side, I run 3 columns of hygiene. So I have 3 hygienists, and that typically comes out to anywhere between 40 to 50 patients. So on a typical day, I'll see anywhere between 50 to about 60 patients on a typical day. This a number actually is a little lower. If you're in a very high volume or high Medicaid practice, I was in one of those previously. I used to see about 80 to 90, and that's quite a lot. I'd probably see about 25 to 30 operative patients, and on top of that, about another 60 hygiene patients. So easily, anywhere from 80 to 90, patients. Right now, I'm in a private practice setting in terms of the insurance. They're more PPO, so they're more fee for service clientele. And so as a result, I'm able to kind of see less volume, which is kind of what I prefer right now, where I am with my career.
Mm-hmm. So how many hours do you work in a typical day and week? And how do you allocate your time for all of this?
Yeah, so I'm in the academia sector. I teach every other Monday at Penn, and then I'm there every Friday, working with the pediatric dental residents there. Tuesday, Wednesday, and Thursday, I'm in the private practice setting, and my hours in private practice are 7:30 to 3:30. So it's nice and like a nice fun day. Get to, like I said, get to get home in time to spend time with the family, which is something I really prioritize, and very important for me. And then my days at Penn, usually, like I said, I do literature review with the residents on Friday morning. So that starts at 7, and I usually wrap up my Fridays around 3 o'clock. My Mondays are a little bit longer, 8 to 5. But like I say, it's those are every other Mondays that I'm there for that.
Mm-hmm.
And sorry, your second part of your question was, and I guess in terms of a typical day, I think this was your previous question, like what I do in a typical day. So dentistry is, like I said, a lot of people think of dentistry and associate dentistry, they're like cavities and, filling the teeth and drilling. And yes, all of that is true. All of that is like your stereotypical dentistry, your dental procedures. So yes, there are, basic cavities that you'll fill. There's crowns that we do. So one of the biggest things nowadays with pediatric patients is the introduction, I should say, of zirconia and a lot of zirconia fillings or porcelain crowns. So a lot of aesthetic dentistry now being brought into the pediatric forefront. And so that's been really, really neat and a lot of fun. Where I specialize in my niche is twofold. One is oral conscious sedations. So every morning I have at least 1 or 2 patients that come in that I sedate with one of, up to 3 medications. One is midazolam or Versed, so it's a benzo. The other one's called hydroxyzine. So it's almost very similar to Benadryl, I say, in terms of an antihistamine. And then the third is something called Demerol. Or Demerol is like it's a narcotic, and so it's for pain management. So it's an opioid. So sometimes I'll use 1, 2, sometimes all 3, and so it's a really nice way to have a pharmacological intervention in terms of my treatment modality. Those are usually reserved for kids who just either aren't cooperative or very cooperative, but just have a lot of work. And so it buys me enough time to take care of their dental needs. So that's really neat, and that's something that that I kind of a little niche that I have. The second thing that I do, and like I said, we'll get to this later in our presentation as well, is one of my case studies today is on frenectomies. So I have a laser. I do a lot of lingual frenectomy. So those of you who may have ever been tongue-tied, know somebody who's been tongue-tied, or a family member, or even lip-tied at the top. I do that in the practice as early as kids are 2 days old, and then as old as adolescents. And so we'll dive into that a little bit later, but those are the 2 little niches that I have.
So what motivated you to pick pediatric dentistry over adult dentistry?
Yeah, that's a great question. So for me, when I was younger, at the age of 2, I had acute lymphoblastic leukemia. So I was diagnosed with that at the age of 2. I've been in remission since the age of 5. So it's been 28 years that I've been in remission. But and I'm very thankful. Like, I didn't have to have any chemotherapy, no radiation. I ended up taking a medication called methotrexate. And so I responded well to that. However, I was very moon-faced as a child, and all kind of the side effects that you'd see with methotrexate on board. However, when I'd go back for my follow-ups at the oncology unit at St. Christopher's Hospital, I just, like I said, I saw a lot of kids who were hooked up to IV poles, shaved heads, like no hair. They were like the happiest kids that you could ever meet. And so I was like, this is really crazy. Like, I'm in a place where these kids, have cancer. They're hooked up to IVs, getting medicated. Some haven't gone home for months, yet they're in bliss. Like, they're in paradise. And as I got older and older and older, I started to realize that kids are awesome, because like everything that you do now, right? Even in your life, no matter where you are in your life, whether you're 20, whether you're 30, whether you're 60, you are shaped a lot by your childhood, your experiences, your fears, what drives you, kind of who you are. Your childhood plays such a huge role in that. And when I was in my teens, I would go back to the, just for my follow-ups, I realized that kids are a clean slate, and you have the ability to mold them like a canvas and paint on them however you want. And the way that you decide to draw on them or paint on them really helps to depict, their life story. And so that's kind of when I realized I wanted to go into pediatrics. Dentistry, I realized, like I said, being ambidextrous, I loved, I was very, like I said, grew up athletic in an athletic household with myself and my brother. I realized that I wanted to use my hands. I personally am a big, I love self and instant gratification. And that's something that dentistry offered while I was shadowing. So I love the fact that someone could come in discomfort or not feeling good about the way they look, and they leave instantaneously feeling a lot better and pain-free. And so that instant gratification was something that drew me personally to the field of dentistry. And so when you combine both of those, that's kind of how I landed at pediatric dentistry.
Mm-hmm. That's incredible that you were able to take that experience and motivate it and use it to motivate you to get where you are. That's incredible.
Appreciate that. Thank you.
So going into your journey to get up to this point, do you want to talk to us maybe about where you went to undergrad and some things you did in undergrad to apply for dental school?
Yeah, so I went to undergrad at Drexel University, which is in the heart of Philadelphia. I'm pretty much a Philly boy. I grew up outside of Philadelphia. I went to school, like I said, undergrad at Drexel, and then I went to dental school at Penn, which is right across the street as well. So I spent 8 years in Philly. In terms of what I did in undergrad, I majored in biology. I did a minor in business administration, which was super cool. I think business, honestly, is just kind of the essence of life. As much as I love dentistry, finance and business is literally what the world runs on. And so having a background in macroeconomics, just accounting, things like that was just really, really insightful, and things I still use to this day, I feel. Uh, in terms of activities, I literally did like one thing. So I was on initially, like I said, I kind of redshirted on the tennis team. That was too like way too grueling in terms of early morning workouts. And like I said, there were so many like international students who were just phenomenal. I had more fun watching them play. And I think I was like 14th or 16th on the team. So I was never going to play anyways. So I quit like within 3 weeks of that, and I actually danced competitively. So I started a dance team, and that was my passion. And I pretty much danced throughout undergrad, even a couple years of dental school. It was like a fusion, like Bollywood Bhangra. If you guys are familiar with Bollywood, it was kind of like a Bollywood dance team. And so traveled, competed, and that was kind of my little baby. Starting my team and then traveling and enjoying that. And so that's pretty much all I really did. All I really had time for. I would shadow, like I said, here and there when I would come back home for the holidays, and if my local dentist. But no, I mean, like that was it. That was pretty much it for me.
Do you want to talk about maybe about how you recommend going about getting letters of recommendation, and what types of things you would recommend getting for a dental school application, like volunteering hours and anything along those lines?
Yeah. So what I recommend is just like having, and one other thing I did, I'm sorry, I should mention, is when I was applying to dental school right before that, I did do a little bit of research. So I do apologize. I did forget that. Outside of dancing, I just researched. I kind of had a passion and an interest for that. So I researched at Penn while I was at Drexel, and I thought that was neat. I did get like published on an abstract. So my takeaway here is that you don't need to do a gazillion different things. Pick 2 or 3 things that you're really passionate about that you can have longevity with, and stick with those. Now, those of you who are already in college, you guys are probably very, very well familiar with that. It's totally different than high school. In high school, you could probably do 10 different activities, play sports after school, and still done your exam, like your homework, and study for your exam, and be totally fine. Collegiate obviously is very, very different, and you're not going to be able to kind of perform at the same level just because of what it entails. So this kind of comes down to, like I said, being strategic in terms of what you like to do, follow your passion, and it doesn't have to be dental related. And that's the beauty of it. So my advice is for you guys out there, if you are a business major or you want to master in, kinesiology, do it now, and if you're going to go into medicine, or if you're going to dentistry, you're going to be doing that for the rest of your life. So right now is the time to really take on something that might be different, that might be unique. If you want to travel abroad or study abroad, do it. Because those are things, I think, when I realized that the way that the dynamic is shifting, and the way everything now when it comes to medical school applications and dental school applications or pharmacy school applications, whichever route in medicine you're trying to go to, the old school thought was grades, exams. Now it's kind of coming down to, sure, your grades are important, your exams are important, but what else do you have to offer? Because everyone is kind of in the same boat. So what experiences or life experiences do you have that are unique, that can really intrigue people, that can hold up a conversation? And I think that's what people are looking for. As someone who's on the admissions committee at Penn, in terms of our pediatric dental residents, that's kind of what I look for. So, your grades are okay. I didn't have, like I said, the best grades at all. But what I didn't have in grades, I lacked, what I lacked in grades, I made up for with my letters of recommendation and just kind of the activities that I did, and kind of the experiences that I had, which were very, very unique. So just make sure that that's the biggest thing is do something different, but do it with passion, do it with intent, and do it with purpose. And if you have that, it'll naturally show. In terms of your letters of recommendation, find someone who can really vouch for you, that really knows you, that knows your true character. You don't want to just go to a person because you got an A in their class. You want to find a person that can really talk about your character, your makeup, like your struggles, that knows a little bit about a piece of you. So I always say that, you don't want that superficial letter of recommendation that's very mundane, very basic, saying, oh, John here is a fantastic student, he got an A in my class. That means nothing, because every university is different. who knows, like that A has no value and has no meaning. But you want to have a professor or a mentor that can talk about your character, that can talk about your leadership, that can talk about a time that you struggled but you persevered, because that's kind of what life is about. That's what dental school is about. That's what med school is about. That's what any kind of professional school or grad school is about, is persevering and making it through. And so that's kind of my little takeaway, my tip from that.
Mm-hmm. So, adding on to that, when it comes to personal statement, obviously you want to capture everything that you've done in your life and why you want to go into dentistry. So, could you talk a little bit more about what you would recommend putting in that and how valuable it is?
Yeah. So your personal statement is, I would have it like your first paragraph. I always say you want to have your first paragraph that's like super intriguing and catchy. And you want to end with a bang too. Not everyone's going to have a time to like read your entire personal statement. So you want to make it about a life-changing experience or a moment that really defines you or define the reason that you're pursuing a field in dentistry. Make it unique, make it something that is empathetic, that the author, it's almost like the author's heart, or sorry, the reader's heart sinks, or they kind of feel a burst of emotion as they're reading that. And so you kind of want to, like I said, hone in on something that's a lot more specific. Try to not keep it generic. And like I said, make it more specific and find a key event in your life or a key moment that really has defined who you are and the choices that you're making. And if you're having a hard time with that, reach out, like, talk to your friends, talk to your family. And, I'm sure something might jog your interest. But you want to kind of, like I said, you want to make that catchy and a little bit unique.
Mm-hmm. So, going off of that, um, as for dental schools, do you think community college classes would be counted as serious as a 4 year? I'm seeing that question in the chat
Yeah.
because if
So you're saying if it's like considered serious, or if there are credits that'll be transferred?
they're asking if it would be considered as serious as 4 years. So essentially, would that reputation, I think, is what they're trying to ask.
Yeah, I mean, in my opinion, like it doesn't, I don't look at community college any differently. It just, like I said, to me, it's about how well did you do, and then what other life. Like I said, your resume is not just like, oh, like these are activities. I look at a resume as, what is your life resume? Like, what experiences have you done? And that's what I really focus on. Like, you can do well in community college, you can do well in a regular university, and that's great. But what I would hone in on, if you're going to like a community college, if you're going and applying to a program that's a little bit more, let's say that the admissions committee is a little bit more old school, yeah, maybe, they may sit there and go like, okay, this college, like Montco, which is next to me, Montgomery Community College here. Sure. And you compare that to, let's say, Stanford. I mean, sure, everyone knows and has heard of Stanford or Duke and some of these bigger universities. That's fine. So that might, like I said, those universities might put you at an edge. But if you come from a community college, I think the biggest takeaway here is that, do as well as you can, but have experiences that, like I said, you guys will hear me like beat the dead horse about this because it's a very, very common, repetitive, but very important theme. Work on your life resume. So have experiences that define who you are, and don't let your grades define who you are. And it's worth a shot. So like I said, where I am, a lot of new professors coming aboard, a lot of new faculty who are on these admissions committee, they are looking, and we are looking past the college. We're looking in terms of your letters of rec. What's your character? I want to see someone that has been challenged. I want to see someone who has failed and then how they respond. I don't want to see somebody who's succeeded all their life, because guess what? In dental school, you're bound to get a C. You're probably down to fail an exam. It's going to happen, and it's just part of life because it's a culture shock. It's grad school in general. And so someone who has failed or has a hardship, I know that they've got that character in them to persevere. And not to say that someone who succeeded all the way through has not, but you can kind of see the mindset is very different. And so to answer that question, if you're coming from community college, I personally don't look at that any differently. Are there people out there that may? Sure. There's stigmas with anything and everything associated, but this is why we're progressing, from 2010 to 2020, things have changed a lot and things are going to continue to change. So the only thing you can do is put your best foot forward, do as well as you can. Make sure you just do well. The biggest thing you want to do is do well academically. Really kill like your D. If you're taking DATs, kill your DATs. And if you're kind of like taking any, like I said, letters of rec, just make sure you have somebody that's really solid and can really vouch for you.
Mm-hmm. Yeah, that's amazing. Because a lot of people in the chat, like they're talking about how they needed to hear about the failure, because that is an important aspect of
I mean,
that we don't
sorry,
really.
it is. I'll just talk about myself. I think a lot of it's like, a lot of people that may come up here and speak a lot. Like, and I said, I was in your shoes one day, and like those of you who are watching, I can't see any of you, but I was in your shoes not too long ago. And I knew what it felt like, wow, like, it's really easy for this guy to say it's for this girl to say it's like they've made it, like I'm here. They don't know my struggles. Like, no, like, I graduated Drexel. I started off Drexel on the wrong foot. Like college for me, undergrad was a huge shock. I started off with like a 2.5 GPA, went from a 2.5 to like a 2.9. I had to work my butt off, and I got to a 3.43, and I still got into Penn. So and I'm not saying this like, oh, like I got into Penn. I'm telling you that, hey, like I worked my butt off, and I didn't need a 3.8. I didn't need a 3.9 to go to like, Penn Dental. I needed to show that I could persevere, that I was on an upward trend, and I had people that could vouch for me. And that I had, like I said, for me, activities that were unique, that were kind of like conversation starters. And that were very people like, oh, that's really different. Like, oh, you dance. Like, tell me about this. Like, tell me about this. Oh, like you researched on like, you did, like studies and not like a transmitter called noggin on mice, and you dissected fetal bones. Like, how was that? Like, well, and it was really, really neat. It was different. It was unique. And I was passionate about it. So when you're passionate about something, it'll naturally show. And so that's kind of my takeaway, is that you don't need the 3.7 to 3.8. If you have it, amazing. Like, that definitely works for you. If you don't have it, it's okay. There's so many other ways to kind of bolster your application. In dental school, I kind of graduated. I went to Peds. I went to Children's Hospital of Pittsburgh for my residency, which is a really good residency program. And I graduated dental school, like I think maybe with like a 3.5, or just under 3.5. And like I said, it's not all about grades. And I think that's the biggest take home message here, is that when you look at a home, right? You don't look at just like one aspect of the home. Like the garage doesn't define the entire home. The kitchen doesn't define the entire home. It's the foundation that defines the home, right? And the strength of the home. It's going to be your foundation that determines who you are. So it's not going to be just one grade here or one exam score there. It's going to be you as a whole. And so work on getting to know you. Work on your why. And that's the thing I always tell people is, what is your purpose? Like, why are you going into medicine? Why are you going into dentistry? Is it because your parents want you to? That's the wrong why. You're going to quickly realize that you're not going to succeed, because you're not doing it with passion, purpose, and intent. And until you realize what your passion, purpose, and intent is, it's going to be difficult. You're never going to make that constant stride. And so find out what your why is. You guys are the perfect time, like when you're in your late teens, 20s, it's the perfect time to mess up, try, something, major in something, and come back and kind of find your way. You can take a gap year. My brother took a gap year. He took 2 years off, and he loved it. He learned a lot from it. Those of you who do want to take a gap year, my only recommendation is gap years are totally fine. I think the stigma that was once there with gap years, you can take it, crumple it up, and throw it out the window. What you want to do with your gap years, however, is make them memorable. So do something. If you sat at home for a whole year and did nothing, yeah, your gap year went to waste, and that's going to be stigmatized in a way, because you didn't do anything to bolster yourself. But if you went and like did clinics, or you went and you shadowed, or you applied yourself and you did something totally different, you went to Botswana and you did a clinic, and shadowed there, super cool, because what you're doing, once again, you're bolstering your life resume, and that's what adds a lot of value.
Mm-hmm. Yeah, that's amazing advice, and I'm really glad to hear about the addressing the stigma around gap years. And we know that your brother's like a huge advocate of it. But yeah, so moving on from gap years, could you talk about what type of a learning curve it was for you going from undergrad to grad school, and some of the difficult aspects of dental school? Like, how do you know if this is something that is really for you?
Yeah, that's a good question. Grad school is like very demanding. So like a lot of the one thing I guess I'm going to transition this, is that I was a biology major at Drexel. was like, oh, I'm a biology major. Like, we're going to delve right into biology. That was like one of my first courses was like development, right? And human embryology and development. I was like, oh, I just took this course a couple of years ago. Great. I think I covered everything I learned in undergrad within the first 3 days of like dental school. And I was like, oh shit. Like, and I'm going to say it because you're going to have these moments. You're going to be like, oh shit. Like, whoa, this gets deep real quick. And you're going to go to class and be like, oh, this is our book. You're going to have an exam on this in 2 weeks. And you're like, yeah, nice joke. It's not happening. And you'll be like, oh my gosh, like I have 300 pages of notes to read and I'm going to test it on this in like 3 weeks. Guess what? You're going to get through those 300 pages and you'll remember everything. And that's the cool thing. I think that there's a big adjustment in terms of just really finding yourself. I think grad school really puts things in perspective because you really, I think, learn the true potential of yourself and just us as a human race, and the fact that how much information your mind and your brain can really absorb. And I think that was kind of the biggest challenge that I had was like, from undergrad where you're still studying, last minute, or a day or two before the exam to dental school, you really have to keep up with the material. But if you keep up with it, you'll realize that, hey, like going through 300 pages in a week or 2 or 3 is really not that hard. But initially it is because it's, like I said, it's finding that balance, that school life balance. And I think that was the hardest part, especially your first year. You're trying to socialize, you're trying to make friends, you're trying to explore the city that you're in. And at the same time, you're getting introduced to a whole new environment. You're kind of thrown in there and you quickly realize that, wow, like, okay, like I'm going to have to really get really good at juggling a lot of things together and being very proficient with my time. And let's face it, a lot of collegiate students out there, we're procrastinators, right? We wait till the last minute and you'll quickly realize that you just can't do that. And so it's almost like a shock, but everyone will adjust. Some people will adjust in 3 weeks. Some people need 3 months. And you'll know, like I said, you'll kind of find that adjustment. Now, I think part of your question was, how do you know if it's not for you? I think you'll just know, I think you'll find you may get burnt out. You may realize that, hey, like this material just isn't for me. But then you'll question your why. And I think, that's what kind of really happens. So if you can do that at an earlier stage, I think it'll make it easier. Every year, like I said, we had a couple of kids who dropped out of my first year of dental school. And then we later found out that like, it wasn't like, it was, the one of my friends, and he's like, hey, I don't think this is for me, man. Like my parents wanted me to do this, but I don't think I'm cut out for it. So I was like, dude, like you're not following your why, you followed your parents' why. And so when you're doing something that is not driven by what you want, it'll be very evident. Like I said, hopefully that never happens to any one of you. But like I said, that's why I think it's so important to like, listen to what you want and go from there. But yeah, I mean, I think that's one of probably the biggest challenges in transitioning from undergrad to any grad school is the workload, the course load, managing relationships with family, with new colleagues, with new classmates, and also exploring and trying to have a life and trying to have a well-balanced life.
Mm-hmm. So it is 8:28. So I was just gonna like go into more about the case study because I know we were talking about dentistry not just being about fillings and doing just checkups. There's so much more to it. So if you want to pull up your case study so we can delve more into different aspects.
Can you guys see this?
Yes, it looks good.
So like I said, I alluded to earlier was that one of the biggest things that I do, and I have a niche is in, frenum releases. So there's 2 types of frenums. You have something called ankyloglossia, which is your basic tongue tie. Now, a lot of you out there, like I said, may have had this when you were younger, had a revision, or may know someone that's, has been tongue tied. There's also called a labial tie, which is your upper lip tie. And so I want to talk about this because a lot of this is so neat. It's in the mouth. It pertains to dentistry, but not in the conventional way that you think. When you think about dentistry, you think about teeth. And the tongue is a very, very important part of the mouth, of the oral cavity, but also plays a big role in terms of sleeping. And I'm going to dive into that, and I have a couple of case examples. So let's dive right in. So here is, an 8-year-old healthy male who I saw who presented with his father for a routine dental check. So he's a patient of, record or patient of care, but it was my first time seeing him. So his chief complaint was he's here for routine cleaning. That's what his dad said. His history of present illness, there were no major concerns. He's eating fine, no discomfort since he's had his dental work done in the past. In terms of his medical history, he's healthy, no medications, no known drug allergies. And in terms of his ASA classification, he's a class 1. So he's nice and healthy. Now, his dental history, like I said, he's a patient of record, and he's had previous dental work done by another provider. And his radiographs were up to date. So I didn't have to take any x-rays on him since they were just taken within like 6 months ago. So EOE is his kind of like his external exam, exam of his outside face. So he was within normal limits there. His internal exam, so his dentition, he was in a mixed dentition, meaning he had some baby teeth and some adult teeth. His gingiva, his soft tissue was within normal limits. So his gums look nice and pink and healthy. And his occlusion. M1B1 means it's an airway assessment. Malampati is how much of someone's uvula you can see. So if you go into the bathroom and go, and stick your tongue out, you'll notice a little thing dangling in the back of your throat. That's your uvula. If you can see your entire uvula, you're a grade 1, or you have an M1. If you can see more than 50% of your uvula, you're a grade 2. If you can see less than 50% of it, grade 3. And if you can't see it at all, just because your tongue's so high, then you're grade 4. Brodsky just tells you about your tonsillar pillars. So he had a Brodsky 2, which means he had a little bit of it. You can see a little bit of his TNAs, but it wasn't including his airway. Someone who has a B4 or a Brodsky 4 means that their tonsils are kissing. So if they stick their tongue out, you'll almost see like two little like little balls in the back of the mouth that are your tonsils that are almost kissing up against each other. And a lot of times these kids are constantly sick, they're snoring, they have a whole array of problems as well. His midlines were on, so when he bites down, he has nice symmetry right down the middle of the face. He had a 40% overbite and a 2 millimeter overjet. So an overbite, like I said, I don't mean to insult anyone's intelligence here, but just kind of refresh. Overbite is how much of your upper teeth cover your bottom teeth. You can either be at 10% or you can be at 100%. And then overjet is the relationship between the distance between the bottom of your top tooth and the top of your bottom tooth, how much that distance is. So if you think of like Bugs Bunny teeth, they're like out here, kids who have flare teeth, they have a huge overjet. And so if you're a thumb sucker, if you know someone who's a thumb sucker and their front teeth are flared out, that person's going to have a longer overjet because the distance from the tip of their top teeth to their bottom teeth is a little bit longer. And so that's what an overjet is. Now, I bring this up because dentistry is more than just teeth. On this picture here, you can see him sticking his tongue out. And you can see he really just can't stick his tongue out that far. So what I will have you do right now, guys, at home is close your mouth and swallow. And where do you find your tongue residing when you swallow? At the top of your mouth. And that's where your tongue should be. In his case, he presented, on further evaluation, when I lifted up his tongue, I spoke to Dad. He was having a very, very difficult time with speech. And the reason why I brought this case is this was probably the most emotional case that I've seen in my line of work thus far. He was 8. He was at home with his parents. No one could understand what he was saying. His speech was that impaired. He had such a tight frenum that nobody could understand because he just couldn't have the tongue go to the appropriate spots to say certain words. So if you're at home right now and you're listening to this, say the word thunder. You'll notice that when you say thunder or 30, 31, 32, your tongue hits the tip of your top teeth. Kids who are very strong tongue-tied can't say thunder because their tongue can't move there. So instead of saying thunder, they'll say funder with an F. It sounds like funder. And they'll compensate that way. That's what happened with him. They can't say R's. So instead of saying Roger Rabbit or Rolling Rapids, they'll say Roger Wabbit, Rolling Rapids. You'll get a W. Now it could be very, very, easy to differentiate where they're saying Wapid, or they could be saying Wapid. And you'll still get a hint of a W instead of an R. Other letters that are affected are your S's, your L's, your N, and your Z's. And so I did a little speech assessment for him when I noticed, in doing his tongue evaluation, and Dad kind of broke down crying and kind of told me their entire life story, how they were in the car. And he literally just told every one of his family members that he hates them. He wished he wasn't born. And it was very, very emotional, to have an 8-year-old go through that type of psychological stress can really impact you. And like I alluded to very earlier, your experiences in your childhood can really define who you become as an adult and can shape you. And so it was very, very clear that what he was going through was having a very negative impact, because those people in his life who he loved the most couldn't comprehend and understand what he was saying. So my next slide here is a picture of me doing a release on him. Can you see it? I just want to make sure on your end. Okay. So I'm using something here called a biolace. Back in the day, I learned how to do a tongue tie with a 15 blade scalpel and stitches into suture. Ever since I've used the laser, it's been amazing. There's no bleeding because it cauterizes the tissue. It literally takes like 30 seconds to a minute. This one took me a little bit longer just because I was taking my time for video purposes. But you can kind of see the tissue there, how it kind of is, you get this little diamond that forms, you know, in the incision site, and the tissue is kind of separating. And it's kind of maybe hard to tell because I'm not zoomed in here, but
you doing okay?
I'll show you guys a picture right after this that shows you the kind of the before and after, along with some other cases that I have, just in terms of how much tongue mobility you're going to get. And you're really going to be able to take that tongue and move it into places that you couldn't do it before. So that was an example of, you know, a video of him having his tongue released. It is not painful, you know, very, very minimal discomfort, if that, but it is life changing. So here's a picture of what his kind of tongue tie looked like before. It kind of attaches, so tongue tie kind of attaches, in his case, to the base of his tongue, more towards the tip and all the way down to the floor of the mouth. His actually kind of extended behind those front bottom teeth that you can see. So after we did it, that's kind of what the final outcome looked like. It looks like a diamond shaped area. You can see there's no bleeding and there's no need for stitches because the laser cauterizes and there's no bleeding, which is phenomenal. Now, here's some other examples. This picture on the left, you can see another kid here with a very, very strong tie that's opening his mouth. The picture here on your bottom left, that is a classic thing that I see very often. You can see the child with a tongue tie and them trying to stick their tongue out and how limited range of motion you have. And then after you do the revision, look how he can almost stick his tongue out, probably double, you know, and twice as long. Now, the tongue is huge in many, for many reasons. When you're younger and, you know, when you're an infant and you're feeding, if you have a strong latch, it'll affect the mom and the baby. So you get latching issues. The child has something called aerophagia, which is when they're suckling either on the mom's breast or if they're suckling on a bottle, they'll take in air along with the milk and they get full within 5 minutes. So a normal feeding should usually be about 15 minutes or so. These kids get done maybe and are full within 5 minutes and they get very, very gassy and fussy. And the reason that is because they're taking a lot of air along with the milk, which is a false sense of satiety. And they feel like, oh, they're satiated and, you know, there's no more hunger. And then next thing you know, 30 minutes later, they're crying and they're hungry again. So you can see the problem this would present for a mom who now is up all night trying to feed her child every 30 minutes to make sure her child is being fed. Whereas a child who does eat well and has constant feeding, you know, has a good feeding, might go, you know, for another 2 or 3 hours until their next feeding. And so, you know, that's the biggest thing you'll see is aerophagia. You'll see kids dribbling milk from their side. You hear them go when they're, you know, feeding. So you'll hear clicking or popping sounds. And on the mother's end, you know, you might see moms or, you know, hear about moms who have like cracked nipples, bleeding nipples, constant pain, big time. They feel guilty. And so these are things that, you know, should not be there. Breastfeeding is a very natural phenomenon. It should be pain-free for the mom and it should be pain-free for the child. And so, you know, that's not always the case. The picture in the middle there, you can see the surgical site, and then you can see a 2-week follow-up, how nicely that heals. So the healing on this is fantastic. Usually takes about 2 to 3 weeks in terms of healing, and that area closes up real nicely. Before I jump into the other 2 pictures that you see on the right side, I'm going to talk about, like I said, the other thing that you'll, you know, in terms of frenectomies are catching them. If you're a school-age kid, so if you know someone who's 6, 7, 8, this is probably the prime time to catch this because if you had it when you're younger, but you got through feeding, great. It might catch up with you when you're in your school, when you're school aged. The tongue plays a huge role in cleansing. So if you're at home right now, take your tongue and sweep it all around your mouth. That's something that you should be able to do very, very easily. The tongue plays a huge role and cleansing. If you have food stuck in your corner, you should be able, instead of using your finger, your tongue should be able to go and clean it and swish around and clean your food. If you're tongue tied, a lot of kids can't even get their tongue around their top front teeth. And so that's one thing to keep an eye out on. FROM is full range of motion. You want to be able to take your tongue and take it anywhere in the mouth. And so that kind of goes along the lines of cleansing and also leads into speech and sleep. Speech-wise, I went over some of those sounds and how phonation and dictation are a huge part in development of a child who's, let's say, 7 or 8, and having a free access to that tongue allows you to have coherent and cohesive speech. Now, the other thing here that I love is sleep. Kids who are severely tongue-tied, you'll notice, like I said, when you close your mouth and you swallow, that tongue hangs out on the roof of your mouth. Well, if you're tongue-tied, sometimes you'll try and sleep. You'll start off with your mouth closed, and as the night goes on, you'll do one of these. And you start mouth breathing. Mouth breathing is something nobody should be doing. When you close, when you're nasal breathing, you release a lot of nitric oxide, causes vasodilation. So it's really, really good for the body. Nasal breathing is definitely, is a natural phenomenon, or should be a natural phenomenon. The mouth breathing has a lot of negative things associated. One, if you're constantly mouth breathing at night, when you secrete a lot of growth hormone, you're growing. So when you have an open mouth, you're going to start growing, your jaw is going to start growing down and out. So you get something called a dolichocephalic facial profile, which means you have a much more elongated face than you do a wider face, which is why today, given like the softer foods that we're eating, along with the facial profiles that we have, a lot of people just don't have room for all 32 teeth. I'm sure many of you here, including myself, we've had our wisdom teeth taken out. If you look at the anthropology of people back like from the 14, 15, 1600s, especially on the continent of Africa, they used to have, they used to chew and have such like, kind of like raw food, so to speak, and use their muscles of mastication that not only would they grow a little bit longer, they'd also grow wider, have nice cheekbones, and they're able to fit all 32 teeth in their mouth. And that's something that kind of ever since the Industrial Revolution, we've as a society have kind of slowly gotten away from. And so that's why, because sleep is such a huge issue. ADHD, bedwetting, a lot of these things that you'll hear are related to sleep. And one of the other things is bruxism and sleep disorder breathing, which affects adolescence, which is that last kind of like blue highlighted segment there. If you get through school aged and you still have a speech issue, you'll see a lot of people as they get into their adolescence, more and more mouth breathers. If it becomes a chronic issue, you could be into your 40s and 50s and eventually go into a CPAP. And those are things that you don't want to get to, because that's going to affect the quality of your life. So the goal here is to improve a child's quality of their life as early on as possible. So the last two pictures now are labial frenectomies or upper frenum releases. So the ones that I showed were lingual. So these are labial, they're on the upper. That picture on the bottom right is an infant. That baby was 2 weeks old, was having a hard time feeding, and the lower lip was fine. But the reason the upper lip was an issue was when they were feeding, the upper lip curled in like this. If you can see my lip, how it's curled in, and it kind of blanches, that's exactly what that baby's lip looked like when they were feeding on the breast. So instead of having a wide open, if this is the nipple, instead of having an open C-shaped suction, the upper lip kind of curled in. And as a result, it was painful for mom on the upper part of the breast, and the baby just wasn't feeding well and getting very fussy. Once you remove the frenum, you can kind of see how that blanching, you can kind of see that blanching initially on the first picture on the left, and how that blanching went away. On the top, that's an adolescent who is about to get orthodontic treatment to close the gaps in the space. I usually don't recommend having your upper frenum relieved until you're about 11 years old and you have your canines come in and you're working with an orthodontist. At that point, they can easily close the gap up for you. A lot of babies are born with an upper frenum and you don't need to have it removed. So the big other takeaway here is that not all lingual frenums and not all upper labial frenums need to be excised. It's a case-by-case basis, but you're going to ask the right questions to see if that's an area of concern. And so that's kind of what I want to touch base on. So you can't diagnose a tongue tie by pictures alone. You do something called the Murphy maneuver, where you take your finger and you swipe it on the floor of your mouth. And if you get a little road bump in the back, or it's something that's kind of doesn't allow you to move your finger free-flowingly, and that's usually a sign that, hey, you might have a tie back there. And once again, not all ties need to be released. And so this is kind of like my case that I wanted to talk about because I feel like airway is such a huge part in terms of growth and development. I say the mouth is the gateway to the rest of the body. And so the way you take care of your mouth, the way your tongue functions, the way your mouth functions really sets you up kind of for success for your life, or it can set you up for failure for your life. And so I thought, talking about frenum releases and how life-changing they have been for a lot of my patients, how it's something that is within the world of dentistry, but also not in the world of dentistry as well. It's something that you really wouldn't expect and think of, but has some amazing benefits. So if you guys have any questions on that, feel free to, ask me. But that was my little case presentation on that.
Yeah, someone actually had a really good question.
Yeah.
If tongue ties are genetic?
That is a great question. So yeah, it usually happens like seventh week of development, embryonic development. They can be genetic. It's just a little extra, flap of tissue. And so to answer that question in a nutshell, yes, they can be genetic. At the same time, you can have certain people in the family, one get affected more by it than the other. But yes, good question.
Another question was, when you perform that surgery, how long does the scarring typically last?
Yeah, so there's no scar, which is awesome. That's the beauty of it. It looks like it's scarring because it looks black, but that's just from cauterize. It's from the heat cauterization of the laser. So what I have is a diode laser. So diode laser, if this is my tissue, this is my laser. My laser has to contact the tissue when I cut, which generates heat. And as a result, you can see some black areas of the tissue. If you have a CO2 laser, you don't need direct contact. You can kind of pull that up a little bit further, about a couple of, few millimeters or an inch or two away from the tissue, and cut, and you get a lot more or a lot cleaner cut with the CO2 laser. I've used both. They both work really, really well. So I don't have any qualms with either one of them. But there's the beauty of this is there's no scarring because you're working in an area that's so highly vascularized that blood vessels come and kind of, like I said, you'll never, like I said, if you ever if you're ever in a snowstorm, you'll notice that your fingers and toes, all the extremities will get frostbitten first. But I've never heard of a case of anyone having like a necrotic lip or necrotic tongue just because of how much vascularization you have in that area. So as a result, you will not have scarring, which is awesome.
Yeah, that's amazing. This one's kind of like deterring away from the surgical aspect, but have you ever faced racism from a patient or patient's guardian? And if you have, how do you handle a situation like that?
Yeah, that is such an awesome question. Yes, I have. In residency, I had a patient who did not want to see me because of my ethnicity. And actually it happened twice. So you just kind of said, you be professional about it. There's some instances, like the one example was my co-resident. She was from Saudi Arabia, and she wears a hijab, and so they did not want to see her. So I came in, and she came back, and she came out of the room, and she was a little bit upset. And she speaks English very, very well, right? So, but people just stereotype based on the way they look. So she came out, she was upset, and she's like, "Hey, this mom is being racist." I was like, I got an idea. So I walked in, and I didn't mean to be racist, but I just put on a very, very thick Indian accent. I was trying to be funny, and I was like, I got a perfect solution to this. So I went into the room with a very thick accent, and the mom had no idea what I was saying because I did it on purpose. And my goal here was to teach her a lesson that, hey, you're American, regardless of the color of your skin. And as soon as I left the room, I was like, okay, I'll be right back. And when I left, the mom turned to the assistant, was like, could we actually have the female doctor? I'm comfortable with her. And that really opened up my eyes because that was a direct thing that happened in residency. Now, do I get that in work too? I've gotten it all the time too. Parents questioning, hey, treatment plan. Hey, we went to this doctor. Are you sure? A lot of times I'll get stereotyped in another light, which is oh, you're Indian or you're brown, you must be smart. And it's like, dude, no, that's not necessarily, I appreciate, like I said, okay, I'll take it as a compliment, but no, I'm not naturally gifted. I've worked hard, to get to where I am. And so, it's just, like I said, it's sure, okay, I appreciate that you have faith in me, but at the same time, don't, that doesn't take away from my colleagues who are equally as brilliant. And they may not be of Asian descent, or Indian descent. And so I've seen it go both ways. So does it play a role? Yes. I think a lot of it just depends on location. and where you are. I've been in the Northeast, like I said, most of my life. In Philadelphia, just because of how diverse it is here, it hasn't been an issue. When I was in Pittsburgh, which is more of, more Caucasians, yeah, I did face a little bit more of that. And colleagues of mine faced a little bit more of that. But you realize that for someone to say that, the insecurities lie with them and not with you. And so all you can do is be professional. And the biggest thing I always learned from one of my mentors was kill people with kindness. And when you kill people with kindness, after a while, like, they just have nothing else to say to you, because they know that, nothing that they say is going to phase you. And I've used that in my practice with patients who are not necessarily racist, but don't agree with something or come off very rude about something. And I just stay even keel, kill them with kindness. And you may get an apology, you may not, but you walk out and you'll realize that the tone shifts very quick because nothing will phase you. And at the end of the day, you're a medical practitioner. You have a Hippocratic oath, and that's to, do no harm. And so at the end of the day, I say, try to put your blinders on. There are some ignorant people out there, but your goal is to provide the best care that you can provide, not get into, a boxing fight or a fight of words with somebody else. Like I said, that's kind of when I say I use my professionalism. I've gone through schooling, so I consider, all of you out there who are going through schooling, you're educated, right? So I say, be the bigger person, let your education drive you, and just take the back seat. After all, at the end of the day, you are in a position of service. Whether you're a pharmacist, a doctor, a PA, a dentist, you're providing care, and so make that your focus, and then, kind of said, try to diffuse the situation the best that you can. That's a very good question.
That's amazing advice, because sometimes it can be hard to deal with these situations when you're not of the Eurocentric facial features or skin color.
Yeah.
But I saw another really good question. How has your work life shifted ever since COVID has hit?
Yeah, that's a great question. So we were off from Pennsylvania for 3 months. So didn't work for 3 months, which was really crazy. Did some teledentistry from home, which was really, really neat and really cool. Unlike medicine, where I feel teledentist or telemedicine has a huge role and you can do a lot with telemedicine, I feel like dentistry is a very tactile field where you need to have a mirror and explore and feel certain things and evaluate and look certain things. For example, a tongue tie, you can't just look at a tongue, you have to evaluate it and do some speech sounds and testing and things like that. So the teledentistry was, like, at least nice. It was comforting to let our patients and parents know that, hey, we're here for them. But in terms of actually, like, long-term benefit, it's hard. It was very difficult. But you're pretty much just triaging from home. So those were those first 3 months. Coming back, it's just different, right? Like, I think about dentistry, we're probably the profession that is at the highest risk, because we're, like, literally inches away from someone's mouth. But prior to COVID, this is what we were doing nonstop for the past hundreds of years. And so, in a way, it's like COVID, but in a way, it's like, hey, like, we've dealt with, like, other diseases and other, airborne pathogens just because of our profession. Since COVID, I've gotten a respirator, really decking out with a face shield. The time it takes initially to have these aerosols, there was a policy where you had to wait 15 minutes to let the aerosol particles drop. That law, or that kind of notion has since been lifted, so we're able to clean the rooms right away. But we had to stagger, and, like, our schedule had to shift. So instead of seeing patients, let's say, every 30 minutes, we'd have to lengthen our appointments to 45 minutes. And take extra precaution in terms of cleaning the rooms. We had to put dividers or barriers in areas where it's a common area. In the private practice setting, we have a really sick waiting room that has arcade games. And, like, the kids die to come there, and just, like, before it's their turn or after, they're waiting for their sibling to finish, they're playing arcades. Like, they're not doing that anymore. They're waiting in the car. We're calling parents, having them text us when they arrive. Once, they text us, we let them know, hey, come in, do a temperature check. And that's very, very formal and rigid. And so from that aspect, it's definitely slowed things down. In terms of production, it initially affects anyone's production, because if you imagine, let's say you're seeing a patient every half an hour. In a 4-hour span, that's like 8 patients that you're seeing. But now let's say you're seeing a patient every 45 minutes. You're seeing half the amount of patients in a 4-hour span now. And so from a production point of view. You're making less for your company. You might be taking home a little bit less. And so that was kind of the drawback too, in terms of how that volume affects people on a financial level. These last couple months have been great. I mean, they're kind of back up to schedule. We've kind of been finding a more effective and efficient way and system in terms of, delivering our patient care. And so it's kind of been fine. I think we're probably more busy now than we were before. Parents have been very understanding. That's been one of the bright sides of this, is that parents are super appreciative. No one's really complaining. They're very grateful for whenever they get their appointments. Sometimes parents are like, no, I only want the 7:30 in the morning slot, or no, I want the appointment at the very end of the day because I don't want little Johnny to miss school. Now they're like, you know what? I can see the stress and the burden that you guys are going through. I can see how challenging it must be for you guys. Whenever you have availability, just squeeze this in. And it's kind of cool because like a lot of empathy has been shown. And sometimes the healthcare provider, like, you don't look for the thank yous, right? I mean, if you're looking for the thank yous, you're in it for the wrong reason. And I always say that when you open the door for somebody, you're going to a store, you open the door, don't expect a thank you. If you expect a thank you, you're doing something not for the right reason. If you want to open the door, open it because that's who you are. And that's the kind of person that you are. So it's the same thing in healthcare. You're delivering care. You're in healthcare because you want to be in healthcare. You're not looking for the accolades and the gratitude. If you get them, great. But I feel like we've got a lot of them. And I think, people start to realize, hey, you guys are first responders, and, dentistry is essential. And I think that's the biggest thing, is that a lot of kids, especially when you're a child, you don't want your child to have a toothache and there's nothing you can do about it. So I think a lot of parents have realized that, hey, thank you. Thank you for what you guys do.
Mm-hmm. That's amazing. Just real quick for time's sake, would you be able to talk about the process of specializing after dental school and how you got into pediatrics, and then just a quick word of advice just to wrap it up?
Yeah, sure. So in terms of dental school, you have to do 4 years of, grad school. Your third year going into your fourth year is when you start to apply. And so there's so many different specialties within dentistry. I think there's 9. So you obviously have pediatrics, you have endodontics, which are, like root canal specialists. You have periodontists, which, deal with gum and gum issues and gum surgery. Orthodontists, which you guys have all heard of, and some of you may even had orthodontic treatment or Invisalign. There's oral surgery. There's dental IV, or like dental anesthesiology, which is something. I have an anesthesiologist that comes to my office, and every 3 to 4 weeks we do like GA cases where some kids are just fully put to sleep. And so that's kind of been a new branch of dentistry. And then you kind of have like ODE, which is like oral diagnosing different pathologies. And doing biopsies and things like that. So there's a lot of different specialties and branches that you can go into. There's someone who I spoke to who's really interested in forensic dentistry too. And so it's really neat in terms of like kind of the different outlooks and the paths that you can take. Each one of them are going to have their own years of training. And so it just varies in terms of what you want to do. Pediatrics is 2 years. And you can either do your pediatric residency training in a hospital-based program. So I went to Children's Hospital of Pittsburgh, and that was purely in a hospital program. Or you can do something that's a little bit more university-based, and that's where I teach right now. So the residents that I'm privileged to work with mainly spend most of their time in or at University of Pennsylvania in the dental school clinic there. Now, they are affiliated with CHOP, so they'll do their trauma cases and they'll do their OR cases at CHOP, but majority of the time they're in the dental school. And so that's kind of how pediatric works. Second part of the question, I forgot.
Just like any final words of advice to anyone who might be considering dentistry as a potential path.
Yeah, path. It's a great profession. I like it because of the autonomy. And so for me personally, I could say biggest thing a lot of people ask is, hey, like finance, right? It is an important question. Financially, yes, it is very lucrative, but that's not the reason like why you're also going into that. Sure, it can be a component of it. It should be a component sometimes of no matter what you do. But you want to make sure you have the love and the passion for it. So when I teach in academia, I'm not making as much, for example, as I'm making on the couple of days that I'm working in private practice. It's like not even close. But I do academia for the love of it, right? For the love of teaching and for giving back. And hopefully, like I said, the love and the care that kind of I was given when I had leukemia. And my dental school experience was terrible. I had like really, really terrible experience in dental school, berated, like made fun of by my professors. Like it was not a good dental school experience. And I went to academia because I was like, I don't want anyone to ever feel that way. When you're in grad school, your goal is to make mistakes. It's to find your way. You shouldn't have the pressure to be perfect. So if you're going to make a mistake, do it while you're in school. That's the whole point of being in school. And so I wanted to come from a place and teach with love and compassion rather than fear and ego. And that's the reason why I'm teaching. So my advice is, find your why. That's the biggest advice I'd have, is find your why. Find what drives you in life. Find what makes you happy. When you wake up in the morning, what really fuels you? And then in terms of dentistry, it's a great, great profession in terms of autonomy. You're able to set your own schedule. You're able to set your own hours. And like I said, it's also lucrative, and it's very, very, rewarding in that sense as well. Challenges, sure. Like I said, I'm okay with time. If you want me to talk about, I know there's a couple of questions on challenges in terms of dentistry, or if there's any other questions out there. But those are the reasons, the pros in terms of why I would pursue a career in dentistry.
Because a lot of people are very thankful for all the advice today. Someone even went and said, "This doctor healed my depression," to be honest. But
of course, no, you're very welcome. Like I said, yeah, it's honestly like I as much as I love dentistry, I like to, like I said, for me and like a lot of the residents I'm able to teach, talking to you guys, life is more than just grades. I think that's one thing I want to tell you guys is, if you find somebody who has their GPA and their college that they went to on their like tombstone, come to me, I'll pay you $1,000. I don't see it, because no one cares about in life, right? No one cares about that. Everyone cares about the empathy. How have you made someone feel in life? What have you done to put a smile on somebody's face? What have you done to better somebody's life? That's where you're going to healthcare, right? That's what you're going into. And so, it's hard, and I was in your shoes. I had pressure from parents, and you realize at some point, I wish someone told me earlier, which is why I feel like I'm so lucky to talk to you guys today, because even if I can impact just one of you and get you out of your rut or get you out of that depression, you're meant for so much greatness. You just have to find your why. And if you're like, I'm confused, it's all right. That's the whole point of messing up and being confused, because you're in your 20s. You got your 30s, 40s, 50s, 60s. You got your whole life to do medicine and your whole life to figure yourself out and to do what you love. So spend this time right now really trying to, doing different things, taking a risk, taking a chance. And that's kind of like my message is live the life you love. On Instagram, like I said, I'm the superhero dentist, and my signature line is be your own superhero. Find the power that's within you and that drives you to be your own superhero each and every day. And that's it. Live the best life you can, and live it on your terms.
that is amazing advice. Thank you so much for all of your time today. We are very much appreciative of it. Is there any way students can get a hold of you to contact you if they have any personal questions that if you're okay with that? So if you have like an Instagram DM or like email or any way that you're comfortable with them reaching out, if you could just tell them right now.
Yeah, so you can find me on Instagram at the superhero dentist. Ask me anything and everything. I reply to everyone. I said, we're in this life together. So what a better way to go through life than, throwing out a helping hand and dragging people up with you to success. And I hope you guys do that for somebody one day as well, when you are 10, 15 years later and made it in your career and you realize that, hey, I made it. I stressed out for no reason.
That's it right there. Thank you so much again for your time. And if you guys had any questions that were left unanswered, please just DM him. I'm sure like whenever he's got the time, he will go and answer that. I saw a lot of questions about summaries. So if you guys check the link in our Instagram bio, we have a guidelines slideshow. So you guys can just check that out and turn your summaries in so you guys can get a certificate verifying your presence today. Thank you again, Dr. Shah.
Sure. You're very welcome.
And we will see you guys all next week. Bye.
Thank you again. Have a good day, everybody.